Hello, everyone, and welcome to another episode of Teeth Matter, the podcast where we talk about the highs, the lows, the truths about what it means to have a career in dentistry. I'm your host, Ellie Halabian, DDS, and in this episode, we're chatting with Dr. Mehrdad Raz, a distinguished figure in the field of biomimetic and minimally invasive dentistry. He graduated from dental school in 2019 and is already the founder of Oral Design Beverly Hills, a practice dedicated to providing top-tier dental treatments that emphasize natural aesthetics and patient-centered care. At USC, he found his mentor, Dr. Pascal Magne, and since then have co-authored multiple publications in esteemed journals, including the Journal of Dental Materials and the International Journal of Aesthetic Dentistry. His contributions to dental education and practice are further demonstrated through his role as clinical director at Magne Education. If you're a dentist looking to understand what biomimetic dentistry is, or what the role of immediate dental sealing is, or maybe the importance of diagnosis and treatment planning, or other innovative approaches to patient communication, then this episode is for you. Let's get into it. Hey everyone, I'm all about keeping it real when it comes to life inside and outside the dental world. And let's be honest, good sleep, solid health, and keeping our mood in check are what keep us functioning at our best. So, I put together a list of my go-to products, the ones I actually use every day to help with all that. If you're looking for game-changing sleep essentials, wellness must-haves, or little things that just make life better, check out my affiliate page. Head to teethmatter.squarespace.com/store to see what's in my daily rotation. Plus, if you grab something from the list, it helps support the podcast. That's a win-win. Thanks for being here, and let's keep leveling up together. Dr. Mehrdad Raz, thanks so much for being on Teeth Matter. How are you?
Thank you, Ellie. Good. It's a pleasure to be here. I'm excited for this. Great. Strange time in Los Angeles, but we are moving forward. Everyone is positive. We've started a great week, and I was looking forward to this podcast today.
I know it is a difficult time, but I'm glad to see that you're doing well. And I'm excited for us to have this conversation because you are somebody who, correct me if I'm wrong, but you've graduated dental school not too long ago, and you're like on this fast track. You're so involved in dentistry when it comes to research, when it comes to teaching, when it comes to clinical practice. So just let's take me back a little bit and just tell me when you finished dental school.
No, you're absolutely right. I graduated 2019.
Okay.
And I was just fortunate to be around individuals from the very beginning that really gave me what I was asking for. And I realized early on that dental school is what you make out of it. The more you ask, the more you get. And I just became thirstier and thirstier. And one thing led to another. And, I fell into this world of research and restorative dentistry. And it's just been fun.
Like I said, I've seen the research that you do. You're so heavily involved in it. Now you're the clinical director at Magne Education, which is a prestigious teaching institution when it comes to biomimetic dentistry. How did you end up in that role?
Well, my relationship with Dr. Pascal Magne as a mentee started back in USC when I was a dental student, the DDS program. Back then, his research center was only open to international students. So if you wanted to do research with him, you had to be part of a PhD, international PhD program, and you would get to spend a year of your PhD in his research lab at USC. Basically, that was the only way. I think I showed up to his office at least 20 times. And that was during my second year that one of the visiting scholars did not get their visa on time. And then he remembered me. So we started chatting and he said, this has never happened, but let's work together. And the rest was just fun. We got to do a lot of research together. I learned photography from him. We would do selective aesthetic cases together at the clinic. I had no weekends, but I went through that experience with a lot of joy, and that really set the foundation for me to fall into this type of dentistry. And then at Beverly Hills Dental Lab, Sam Alawi, I don't know if you met him during the symposium, but he's a master dental technician that's really put together one of the best dental labs here in Los Angeles. So back then, he was also growing his education center parallel to his laboratory. And part of his project was creating a dental clinic for live patient courses and, education. And I was so fortunate to join this project as an educator. And, eventually I became the clinical director, and I would perform live patient demos, and we would host over the shoulder experiences. And, we really wanted to also provide continuum of care for all those patients that came to volunteer to be our subjects. And just trying to provide that continuum of care, we went from seeing a patient or two a week to now being a month booked. So, by nature, it became a fully operational clinic. And then when Pascal and Sam joined together to create Magne Education, this was the perfect marriage of these two stories, And by nature, I became the clinical director. So I basically performed the live patient courses and the over-the-shoulder experiences at the center.
For people who are not that aware, not accustomed to what you do, you're referring to this type of dentistry. You're talking about biomimetic dentistry, correct?
Correct. Yes.
Now, can you define what is biomimetic dentistry, and is that the same or is that different from preventative dentistry?
Actually, this is a very good question, and it goes hand in hand. And there are very complex definitions of biomimetic dentistry, but I really want to try to make this as simple as possible. And for me, biomimetic dentistry, it's the type of dentistry that has a lot of respect for nature and preserving it. So if you're a dentist and you label yourself a biomimetic dentist, you actually need to spend a lot of time studying all the components of the natural dentition. You need to really understand biologically and functionally, how are all these structures holding together? Why are they designed this way? And you need to understand all the components of it and how they react to physical and chemical forces. And when you really go deep into understanding dentin, DDJ, cementum, enamel, why are they fused together? Why is every tooth has a different percentage of all these components? You then just get so fascinated by teeth. And then you realize that there is no way I can replace this structure with composite, zirconia, Emax, Feldspathic, have the best lab in the world. There's no way you can replace this structure the way it was. And then when you get to this realization, your love for preventative dentistry grows. And then you start asking, what can I do so that I don't have to prep the tooth to begin with? And then that sets the foundation for all the principles of biomimetic dentistry. And then it goes into, okay, then when you have to replace, what combination of materials and procedures can you use so that the part of the tooth that you're replacing really represents and mimics what used to be there. So you see, it's a full circle. It's not biomimetic dentistry versus preventative dentistry. When you have that love for nature, first of all, you don't want to take it away. So you become much more minimally invasive than traditional dentists. And then when you want to replace it, you become very selective on your procedure. And then isolation, bonding agents, and all that comes after.
Well, this is going to be my next question. Because you have to know so much about, I guess, diagnostics, what do you think is, and at the same time, I think biomimetics is an art. When I see something on Instagram, I'm just like, wow, this is beautiful. Like to mimic nature is incredible. Do you think that treatment planning and diagnosis is more important than the actual clinical skill?
Absolutely not. No. I actually think diagnosis is, at least for my generation, is very underrated in dentistry.
Okay.
And I feel like as I speak for myself. We got really distracted by this huge wave of digital dentistry that just hit us while we were graduating, all the scanners coming in. And I think that was a big distraction to the simple basics, diagnosis and treatment planning. It's not hard to do single tooth dentistry and do it perfect. I think having a very good foundation of diagnosis and treatment planning sets the tone for what I call interdisciplinary dentistry. And that's really my goal with every patient that I see to treatment plan. And I think of restorative dentists as quarterbacks, creating strategies for patients to really get the best treatment possible, even though we might not really do everything. I don't think it's a good sign for a restorative dentist to do extractions and grafting and endo and isolation and perfect restorative dentistry. There may be a few in the world that can do it and they do it perfectly. But I know my boundaries, and I think those boundaries are perfectly defined by treatment planning. And that tells me as a dentist that I need to have a very good knowledge of periodontology, endodontics, and orthodontics so that when I meet a patient for the first time, I can really know all that is available for this patient to get the most comprehensive care. And I think this is the most important part of any treatment plan we do on a daily basis. I don't take pride on doing a single tooth, but with perfect isolation, putting staining in my composite and making it look real. If I'm missing occlusion, airway, and so much more that goes into this concept of interdisciplinary dentistry, then I'm not doing any favor to the patient.
So do you have a certain checklist that you kind of address when you're diagnosing a patient or treatment planning?
No, so, I have made it simple for myself because you see, the question that you asked, if you ask anybody, they will feel stressed right away, especially young dentists like me. I'm like, oh my God, am I missing anything? Am I missing ortho? Am I looking at the bite? Is this patient broxing? So, as millennials, we don't deal with this kind of situation very well. And it's very important to understand that. So that's where my love for photography really increased, because I told myself, and this is, a big issue, and we talk about this in our courses a lot, that it really depends as a human, when do you do treatment planning and diagnosis for your patient? If they give you the same patient at 8:30 in the morning, you may diagnose them completely different than if they give it to you at 5:30, end of a day. You're tired, you've prepped, your staff want to leave, and we all know that. That's the truth. So I said, how can I eliminate this pressure? And I realized that, okay, I'm going to put a simple rule for all the patients I see. If it's one or two diagnoses, I discuss that with the patient. I pull out an intraoral camera, I show them, I go over the x-rays, and I felt like that's enough information for me to be able to handle, and for patient to understand and go home. If it's more than that, we do not discuss treatments, or we don't do any treatment planning. That session becomes purely a data collection session, which means we do our FMX, we do our periodontal charting, but we also do scanning and full mouth photography. Then we take our notes and patient goes home. And then I put a little presentation together for these patients. At the beginning, my friends were like, you're crazy, you're wasting your time, who has time to do this, you don't even understand corporate dentistry, all these things. But then I realized, wait a minute, if you charge for this kind of exam, then everything will make sense. You don't have stress to lose time. And by practicing it, you only get faster. And then you realize that your staff all of a sudden are more interested because they want to do the photographs. They want to help you put these presentations together. And almost every single time I do a presentation, I see things that I would have missed chair time. And then I do a Zoom call, or I meet the patient in person. I pull up the presentation and we go through all the problems, quadrant by quadrant, just looking at a screen while we're not sitting in a dental chair. And just the dynamic changes, and especially for bigger cases, I always encourage the patient to go and get a second opinion. And almost 100% of those patients end up coming back because they always say that no one has really translated what I need to this, level of transparency. And that gives you a lot of room to make sure you diagnose correctly and you choose what's best for the patient.
Interesting. So instead of sending the patient away with a treatment plan at the first appointment, you really see a difference, or the patients also see value in coming back or having a second conversation afterwards.
100%. But other than that, you send them a PDF of this presentation. And this is where you save time. And anytime they have a question, it's all in the presentation. If they have an appointment and they don't remember, why are we doing like a MO inlay and a filling, and on the lower right, you say, you know what, this is a link to your presentation. Go to page 6, you'll remember everything. And they love that. It's the most visual way to treatment plan your patients.
Now, are you putting this PDF together, or is this assisted with your staff?
It's a combination. I've created a template for my staff so they know where to put the pictures and x-rays. Sometimes I do it all myself. It depends how busy we are. And then they put the notes that we took on all the slides that relate to those teeth presented in each slide. And then I go over this and I type more notes, and either we do a live like Zoom or we meet in person. And sometimes I record my voice and I send it to the patient. That way they can replay it as many times as they need.
I appreciate that. I think that's a great idea. And so, yes, they come back for the second, or they make that second appointment or the second phone call. But do you also see that translated into case acceptance?
100%, 100%, because they just feel comfortable. They're not getting a black and white page with numbers and, codes and prices. They're getting a very colorful, illustrative, descriptive explanation of what their needs are and what the options are. And this is something they can go back to as many times as they need. And when you hand that to them and you say that, feel free to get second opinion, I don't think they will run into that many dentists that will do this level of care. And there are dentists that do it, and those are the ones who inspired me to do this, of course. I'm not the only one doing this, but I think it's a handful of dentists that show that level of care. And I hope more and more dentists get encouraged to do this, because like we were talking about earlier, treatment planning, I think, is the most important, stage of the entire treatment.
I do think that a lot of dentists would be scared to send their patients off for a second opinion. And most of them think that if they just keep it in, that they're doing themselves a service. But I appreciate the transparency and the communication you have with your patients. When it comes to diagnosing and treatment planning, how do you determine whether a tooth gets a composite restoration, a direct restoration, or an indirect restoration?
That's a very good question. I don't always have a definitive answer. And I am very transparent for our patient. So let's say we go into a cracked molar, and we always show a treatment plan to the patient that has the indirect route and a direct route. And I let the patient know that, hey, I'm going to put a rubber dam here. I will take photos of what I find during the procedure. You already know both routes, and they've already heard these possibilities during the presentations. So nothing comes as a surprise.
All right, let's talk about something we all know and love: FIGS scrubs. FIGS is the go-to brand for healthcare professionals who want to look good, feel good, and perform their best. Whether you're on your feet all day or tackling tough tasks, FIGS scrubs offer unmatched comfort and durability, all while looking incredibly sharp. And because you're listening today, you can snag 20% off your next order using the referral code in the show notes. You already know FIGS is a trusted brand in the industry, so why not level up your wardrobe while saving some money? Check it out and use that code for your discount.
And just combining our knowledge of shrinkage and C factor and the occlusion of the patient and the antagonistic teeth, all these are, pieces of facts that goes into me deciding what I'm going to do for this patient. Of course, if I have a big coverage of this tooth and the patient has a full upper arch of zirconia, I might not choose to go with the direct composite. So it's not really a clear answer. And it's okay to tell your patient that it's not a clear answer. I need to go into this decay. I may need to follow cracks. And based on what I'm left with after everything's ideal, then we pick which direction we go, direct or indirect. But, the materials have changed a lot. And one of my favorite papers that we published together with Pascal and Dr. Suarez is, using fiber reinforced composite for performing large direct restorations. And we used Evrex, which is a composite that has these really long fibers. And, we did these really large direct restorations. And for the first time, we saw that you can create direct restorations that function like indirect restorations when it comes to fatigue resistance. And we are getting better and better as far as improving shrinkage in direct material.
That's incredible. Do you use it as a bulk fill?
Yes, it's always encapsulated. I don't like to call it a bulk fill. It's the best dentin replacement material. And because of these fibers, not only it helps to avoid extreme shrinkage of these large volumes, but also it was the first time after many studies that we saw that the direct group can perform as strong as the indirect group.
That's amazing.
Yeah, I'll send you the paper. I think you'll enjoy reading it.
I would love to. You're spending so much time on a patient to do this direct or indirect. It doesn't matter, but you're taking your time. Not only did you have your first appointment where you took all the preliminary x-rays and pictures, but you following up with this very technique sensitive and time sensitive procedure. Someone's going to ask, how do you bill for this? Because a 2-surface filling or a 3-surface filling doesn't seem to pay much. So how do you go about this?
So I think the key is creating an environment that allows you to do this. And I think working in a fee-for-service environment is the way to go. Unfortunately, the dental insurances are really behind on this technology or these solutions that we're talking about. They make it very clear that if you have a cracked tooth, if you do a root canal and a post and a crown, we cover 80% of it. But if you dare to write back to them that I want to use an aqua care and put on a rubber dam and seal the dentin and, do a direct as a build up and see how it functions, and maybe we do an overlay in 3 months, they're not going to do anything. And this is a very big disconnect. And that's why, it makes me so happy to see most of my classmates now are purchasing their own dental offices and they're creating their own teams and startups, and they're all going the fee-for-service route. And the reason is disconnect between dental insurances and treatment. So to go back to your question, there are offices, even in fee-for-service offices, that do 2-surface composites, and they charge $150. And for that to be profitable, they have to do a few in an hour to pay their overhead, as an example, right? But the way I think about it is that, no, I like to have at least an hour or hour and a half for a 2-surface composite, especially if it's a deep one, because you never know. I may need to do a deep margin elevation. It might take me a little bit longer than normal to isolate this tooth properly. And I want to take photos. And at the end of the appointment, I want to show the patient what we did. This is part of my protocol. But then I charge maybe $1,000 for a 2-surface composite. It sounds a little bit scary, and it might come off the wrong way, but no, if you're transparent about this is what I want to do and this is what I provide, after a while, you will attract this population that come to you only for the quality of care. And by no means I'm saying discriminate. You shouldn't really treat patients who can't afford that. No, we help patients. We do free treatment, a lot of that. But if you want to be a dentist that does really quality care, you have to function in an environment where your fees takes off the pressure of having an overhead from you. And that is possible. And I think that's one of the scariest jumps for dentists who are in network with many insurances, and they're constantly trying to get out and go the fee-for-service route.
I think that's great advice. But I'm curious to know, as your experience grows, right, do you change the cost, or does this cost change at all?
Not really. No. I mean, it's hard for me to answer that question because I graduated 2019. So my prices haven't really changed. But I have calculated my prices based on the amount of time that I think needs to take care of a certain procedure. It's not so. I've never based the prices, based on what I do or my experience or my brand. It's simply at what price point can I sit and isolate a tooth and go through my bonding steps without having the pressure of the overhead. That's simply it.
Now, you do this beautiful work, you spend so much time, and then there's always a chance that the patient experiences post-op sensitivity, or there's some kind of post-op complication, and then they'll be in this mood where they don't appreciate the work that you did, right? How do you feel about that, and how do you deal with that?
One of my favorite sentences that Dr. Magne said in our morphology class back in USC was that the aesthetics is just the cherry on top. So the restoration looking beautiful is not really the goal here. It happens if you have a good lab. But if you go into the deep principles of biomimetic dentistry, you understand that biology and function and mechanics really come first. And if you prioritize these components of your treatment, if you understand immediate dentin sealing and you incorporate it into your everyday practice, you won't have these problems. And because I've only learned to do indirect restorations with IDS, I haven't really experienced patients who have post-op sensitivity. Sensitivity comes from leaving exposed dentin for a long time, or using materials that can create, a big shrinkage. And biomimetic dentistry solves this problem and really lowers the kind of cases that come back to you with sensitivity or the need for decementation. I would like to say this with much more confidence when I'm 10 years in, and I'm not. So I can't really speak so strongly. But so far, since 2019, we've had 4 or 5 years follow-ups where teeth are holding in, there's no sensitivity. But you also said, what if the patient doesn't appreciate your work? I think that's one of the things that we realized during a patient selection, which is very important. And then the more I earn experience, the more I realize that sometimes you have to say no to patients. And another reason why I like doing these presentations, because if I see the patient is not on the same page with me and they just want 10-minute dentistry, and I let them know, listen, I don't think I'm the right match for you, because you have to sit in my chair for an hour and a half. I'll give you headphones. I'll give you a neck pillow. You'll be comfortable, but you can't rush me. And there's no way I'm going to do a 10-minute filling. There's no way I will take shortcuts, because then it becomes a snowball effect and I can't solve your problem. And there are patients who appreciate this level of honesty. And if you're selective from the get-go, then you won't have these issues, hopefully. And I think one of the best things that I'm earning with experience is to understand from the beginning who is a good match for you and who's not a good match. Because if you know this patient is not a good match, but you jump into it because you need to simply produce, you'll realize at the end you'll lose a lot more money.
Right.
And this is one of the most important things to learn, I think.
No, I think so too. And I believe it was Dr. Adamo. He told me the best word he ever learned was no. telling a patient no thank you.
Yes, he is absolutely right.
Now, you mentioned that post-op sensitivity can come from exposed dentin. You said that you've had great success with immediate dental sealing. For a lot of new dentists, they're not really familiar with this terminology. Can you just quickly go over what immediate dental sealing is?
Yes, I think everybody has to search this up. There's thousands of articles about IDS, or immediate dentin sealing. It is basically, okay, so let me break it down for you. I don't know, I don't want to go too deep, so you can stop me if I was. Bonding to dentin has been always a bigger challenge than bonding to enamel. If you look at most researchers on bonding, they're always trying to improve bond to dentin. Bonding to enamel has never been, an issue or a problem, because we've learned that the amount of megapascals we can get with bonding to enamel is, ideal enough for us not to worry about it. So knowing this issue, if you're doing anything, any restoration, any indirect restoration, which means you're not bonding to dentin at the time of preparation, and there is dentinol exposure, you are only lowering your chances to getting an ideal bond to that dentin by waiting. Imagine after you prep an onlay and you don't seal that dentin. That freshly cut dentin, what does it go through? Hemostatic agents from your cord, impression material, putting your temporaries on it, temporary cement, removing it. That dentin is gone. Good luck refreshing it. Of course, you can sandblast, but it will never be that freshly cut dentin that you got access to during the preparation. So IDS simply says, at the time when you prep, just seal that dentin, bond to it while it's at its best, right? And it's common sense. You perform your bonding steps, 2-step or 3-step, and you bond to that exposed dentin after your preparation is done, before you do the rest of your steps. And then you realize that in the future, when you're bonding your indirect restoration, that bond to the ceramic to your IDS is much stronger to that bond of ceramic to an old dentin if you didn't do IDS. Does it make sense?
Absolutely. That makes total sense.
So basically, they did this, I don't know for how long. IDS has been around for a very long time. But the advantages, we can talk about them for days. Reduced post-op sensitivity, higher bond strength. You can try in your restorations without your patients being sensitive. Sometimes I don't even numb my patients because I've done IDS, and you don't need to do any numbing. And more importantly, it really helps your preparations to look smoother. You can take your IDS and, take care of your undercuts instead of prepping more. There is a lot into it, but it's a must. And I think if you call yourself a biomimetic dentist, you must know about IDS and do it.
Right. Now, IDS is on you as the clinician, but then there's restorations that come in from the lab. And I'm sure a lot of people are looking to find a good lab. It's always something that everyone's on the search for. And also labs reach out to you trying to build that connection with you. So if someone's looking for a lab, what should they look for when it comes to the quality?
Yeah, so of course, if you are doing cosmetic cases, you need to look for a lab that understands the face morphology and shape. I think a lot of times color is overrated. If you start doing direct anterior restorations, you realize that the outcome is shape, shape, shape. We get too lost in combining too many colors, and I need to pick this dentin and that enamel. But then you realize that if you have the right texture and if you have the right shape, you can be a shade off and the patient will still be happy and everything will look gorgeous. So when I look and judge a dental laboratory, their ability to create morphology and texture and shape for aesthetic cases is extremely important. Also, how much are they willing to have a system that is repeatable with you as a dentist? I don't think it's a good idea to jump from one lab to lab or work with 10 labs or 15 labs. I think as dentists, we need to be patient. We need to establish a way of communication with our technicians, and that may take 10 or 15 cases to get to that point. But then when you reach a level where the technician knows exactly how you prep, how you take your impression, and you need to spend time, you need to go to your lab and look at your models and ask your technician, tell me, what did I do wrong? How could I have make your life easier? Explain to them what is IDS, why are these surfaces smooth and why the rest are not. And the more your lab is willing to communicate with you and become one as you grow together, the more that is the lab for you to choose. You know what I mean?
Yeah.
So my suggestion is try to connect with smaller labs that would provide this intimate time between you and them, so that you can sync. And then after 15, 20 cases, you just feel comfortable. And it's one team. It's not you versus the lab. It's you and the lab working together.
It's interesting that you were like, explain to them that you're doing IDS and explain why the surfaces look this way, because otherwise you're just letting them make an assumption, and that assumption can lead to a poor result or miscommunication. And if that's the case, do you work with one technician all the time?
No, well, I exclusively work with Beverly Hills Dental Lab, and I've known their team of technicians for now 5-6 years since I was in school. What I like about them is that they work together as a team. They have a CAD designer. They have a few people that, talk about materials, and they really put their minds together for every case to produce something that is excellent. And then there's individuals like Pascal Magne that are one of the top technicians in the world. And I am so lucky to be able to do cases with Michel, because not many dentists that are my age even really know about him. But if you went to USC, you would know about him because you see his beautiful work with Pascal. And if you read Pascal's book, you just see what he does. But these are the individuals that you want to be around. When they're making the ceramic or a wax up, if you're next to them and you're talking to them, you understand their limitations, what they think, what they want from you. So that just helps your preparations to get better. And because I am so close with this laboratory, I prep with what the technician needs to have in mind. I don't prep just to have a beautiful prep. I do wax up driven preparations. And the more you close this gap between the restorative dentist and the technician, the more you enjoy it and the better the outcome will be.
You mentioned Pascal Magne, Michel Magne. Do you have any other dentists that you look up to when it comes to clinical skill?
Yes. A lot of admiration for Dr. Abdi Samani. You mentioned him yourself. He was, I was his associate for 2 years right after school. And he's known as the dentist that gives wings to talented dentists to just fly away. And it's true because, there is a lot that goes into biomimetic dentistry. And the biggest question when you graduate is that how the hell am I going to do this and be profitable? And he's the one who taught me that. How can you create this environment and structure that allows you to do biomimetic dentistry without taking any shortcuts, and you flourish? But then there is many dentists that I got to cross path in my life, researchers and amazing scholars that really affected the way I think. Marco Gresnik from Holland. I mean, you look at the type of research that he does. He was our keynote speaker last year. And you just, realize that the limitations are endless in dentistry when you look at their work and you read their articles and speak with them. And many colleagues and friends that, I got to do research with them: Marco Carvalho, Luciana Suarez, Luis Shishling, and then I like to read a lot. So there's scholars that I haven't met, but they've affected the way I think. I really like reading Tagami. Of course, Pascal, you have to read his book, and reading Pascal's book becomes the foundation. Didier Dici, Francesca Vaiolati, all these individuals I absolutely admire. There are many names that I can't think of at the moment, but the best thing that I learned to do, and I hope to be able to do that still, even when I get older and more experienced, is having the luxury of being humble enough to go and just simply watch other people work. This is something that unfortunately for most dentists stay in their student years. I still crave so much of just going into a restorative office and watching a prosthodontist take an impression. And when you look at how they work with their dental assistants and where they put things, every single time you learn something new. I think everyone should try to do that as much as possible, even though we get busier.
I mean, yes, but that's a beautiful concept, and I see the beauty in that. Being so involved in the dental field as a clinician, as a researcher, as an educator, where do you see the future of dentistry going?
Oh, wow. Of course, more advancements in preventative dentistry. I think that's very important for biomimetic dentistry, and preserving comes first. I hope to see more advanced systems like ICON and resin infiltration that really allows us to treat without removing teeth. Materials that get closer and closer to the nature. And of course, this integration of AI into so many parts of dentistry can be a game changer. And, I always dream about a day where we can create materials to replace decayed or lost tooth structure based on what is being replaced. Meaning that it won't be just one material. It won't be zirconia or composite or Emax. Let's say when we prepare a tooth, we understand what needs to be replaced. It was this percentage of dentin, what we removed, and this percentage of enamel. And then we can 3D print these restorations that combine different types of materials that will give us that. And imagine it can have a dentin component, it will have a DEJ component, and it will have an enamel overlaying on top. And I think with AI, we can get there. And that will be, I will be in heaven. I hope that I live to that date.
Are you working on this right now? Because that would be fascinating.
That will be fascinating. And that will be the peak of biomimetic dentistry, because that's the only way then you can create a restoration that functionally will give you. Because, the reason why teeth, untouched teeth can last in this crazy oral environment is because it's not just one material. It's that soft dentin in the middle, and then the DEJ that's an interface between this soft material and a really hard material on the outside. And it's how these components interact together that this tooth can last 90 years. And have all these crazed lines, but still function in the mouth. And I think the day where we can create restoration that's not one material, but the combination of all these different material with their own characteristics is the peak of biomimetic dentistry.
That sounds fascinating. I can't wait to see that day. But you have such a calming energy, and you have such a confidence when you speak. For someone who's only been out for such a little bit of time, you have done so much. Do you have any bad days? I have to ask you, do you have any bad days, or is there anything in dentistry that you struggle with?
Yes, 100%. First of all, I still have a lot to learn. I'm constantly realizing the gaps of what I don't know, and I'm constantly trying to read so that I can catch up.
Mm.
I feel like occlusion was a very fast-paced learning in our dental program. And I'm constantly going back. And I think occlusion is one of the most confusing parts of dentistry because there's all these different cults of occlusion and you don't even know who to listen to anymore. So there are cases where I'm treatment planning and there is, differences in ideologies that I read about. And those are the days where I struggle. And I am just so lucky to have all these specialists that are next to me and are my friends that I can go to and say, what do you think about this? And, I pick their brains. And yes, actually, for me, the more I practice, the more I realize how much I don't know. And those days where I realize that are not good days for me. But then I try to, give a very positive spin to it and try to make it better and better.
Well, I appreciate you for being honest with me. Mehrdad, it was such a pleasure talking to you. If anyone wanted to connect with you or take a course, how can they do that, or where can they find you?
So you can find me on Instagram. It's dr_Mehrdad Raz. You can share my email if you like in the podcast. I'm always interacting people. They DM me with questions. I love talking to people on Instagram. But most of the courses that we teach are also available at MagneEducation.com. We have a photography boot camp that I'm really excited. Now this March, for the first time, we're doing a 2-day boot camp where we complete photography day 1 and day 2 we going to doing a DSD and editing photos and making presentations. So I'm super excited about that. And then for most of the modules in Magne Education, I do live patient courses. So together with those courses, they will see me perform what's being taught on a live patient within the 2-3 days where they're taking the course. And if you follow me on Instagram, when I do random gigs here internationally or online courses, you'll just see it on my stories.
That's incredible. Thanks so much for sharing.
Thank you, Ellie. Thanks for having me. It was great talking to you, and I'm proud of everything you're doing, and congratulations.
If you enjoyed this episode, be sure to follow our podcast, write a review, leave a comment. Anything you share with us goes a long way. And if you think a friend will appreciate this podcast, then make sure you share it with them too. Until next time, cheers.